If you want to know the state of your heart, you usually have to wait for an appointment, pay for an echocardiogram, or undergo a stressful treadmill test. You think of your heart as a fortress locked deep inside your chest, invisible to the naked eye. But what if I told you that your heart has a dashboard? A display screen that updates in real time, showing you exactly how well your pump is working and how oxygen-rich your blood really is. You are looking at it right now. It is your fingernails. For over 40 years in the operating room, before we even hook a patient up to a 50,000 monitor, we look at their hands. We look at the color, the shape, the texture, and the refill speed of their nails. Why? Because your fingernails are the furthest point of circulation from your heart. If your heart is struggling, if the pump is weak, or the valves are leaking, or the arteries are stiff, the very first place the signal fails is at the fingertips. Your nails are the canary in the coal mine for cardiovascular disease. In this video, we are going to teach you how to read these signals. We will reveal the 5 specific changes in your fingernails that can indicate a silent heart issue months before a heart attack strikes. And we are going to perform the 2-second squeeze test together, a clinical maneuver used by paramedics to instantly assess if your heart is failing to perfuse your organs. But first, look at your hands right now. Do you have vertical ridges running down your nails? Yes or no? Let us know in the comments. Many people think this is just aging, but as you will learn in minute 6, it can be a sign of a specific nutrient deficiency that weakens your arteries. Reason number 5, the clubbing curve, the Schamroth window. Let's begin with signal number 5. This is perhaps the most famous sign in medical history, known since the time of Hippocrates, the father of medicine. It is called digital clubbing. This isn't about going to a club. It describes a condition where the tips of your fingers become enlarged and the nail curves downward, wrapping around the fingertip like the back of a spoon. Why does the heart cause this? When your heart is unable to pump enough oxygenated blood to the extremities, often due to chronic heart failure or congenital heart defects, the body tries to compensate. It opens up wider blood vessels in the fingertips to try and capture more oxygen. This increases tissue growth at the nail bed, causing that bulbous, swollen look. But you might not notice the swelling because it happens slowly over years. So how do you test for it? You use the Schamroth window test. Do this with me now. Take your 2 index fingers, hook them together back to back, knuckle to knuckle so your fingernails are touching. Now look at the tiny space between your nail beds. You should see a tiny diamond-shaped gap of light. If you see that diamond, your angle is healthy. If there is no gap, if the nails press flush against each other, this is a positive sign for clubbing. In the medical world, we call this the loss of the Schamroth window. A study in the British Medical Journal confirmed that this simple physical sign is highly correlated with cardiovascular and pulmonary diseases. If your diamond is missing, do not ignore it. Your heart may be struggling to deliver oxygen. Reason number 4, the splinter lines, endocarditis warning. Number 4 is a visual sign that looks painful, but usually isn't. It is the appearance of splinter hemorrhages. These looks exactly like they sound. Thin, reddish-brown lines running vertically under your nail, as if you got a tiny wood splinter stuck there. Now, if you slammed your finger in a door last week, that is just a bruise. Ignore it. But if these lines appear spontaneously, on multiple fingers without any injury, it is a massive red flag for a condition called infective endocarditis. Here is the terrifying anatomy of what is happening. Your heart has valves that open and close to let blood through. Sometimes bacteria enter your bloodstream, often from the gums, as we discussed in our clove video, and attach to these heart valves. They form clumps of bacteria and clotting material called vegetations. Occasionally, tiny pieces of these clumps break off. These are called microemboli. These microscopic clots travel through your blood until they hit a dead end, the tiny capillaries in your nail bed. They get stuck, rupture the capillary, and leave that splinter mark. A splinter hemorrhage is effectively a tiny blood clot explosion under your nail. If you see these lines and you have also been running a low-grade fever or feeling unusually tired, go to a cardiologist immediately. Could mean your heart valves are infected. This is not a wait-and-see symptom. Reason number 3, the red moon, heart failure. Number 3 focuses on the lunula, that little white half-moon shape at the base of your fingernail. In a healthy circulatory system, This moon should be pale or white. It is the visible part of the nail matrix where new nail is being formed. But in patients with specific types of cardiac failure, this moon changes color. It turns into what medical textbooks call a red lunula. Why? When the heart is failing, specifically in congestive heart failure, the pressure in your venous system rises. Your heart cannot pump blood forward fast enough, so the blood backs up in the veins. This congestion travels all the way to the fingertips. The delicate capillary bed under the lunula becomes engorged with stagnant blood, turning that white moon into a deep red or violet color. A study published in the Journal of the American Academy of Dermatology noted that red lunula are significantly associated with cardiovascular disease, endocrine issues, and cirrhosis. Take a look at your thumbs right now. The lunula is usually most visible there. Is it a crisp, milky white? Or is it blending in with the pink of your finger? Or worse, is it darker than the rest of the nail? If the moon has turned red, your fluid system is backed up, and your heart pump is likely the culprit. Reason number 2. The blue ghost, silent hypoxia. Number 2 is a sign that many seniors mistake for just feeling a chill. It is cyanosis. Healthy blood, rich in oxygen, is bright red. When it flows under your clear fingernails, it makes them look pink. But blood that has been stripped of oxygen is dark blue or purple. If your heart is not pumping efficiently, or if your lungs aren't oxygenating the blood properly, your fingernails will take on a dusky, bluish tint. This is called peripheral cyanosis. Now, here is the critical distinction. If you are outside in the snow, your nails turn blue because your blood vessels clamp shut to save heat. That is normal. When you warm up, they should turn pink instantly. But if you are sitting in a warm living room, wrapped in a blanket, and your nail beds are still blue or gray, this is a medical emergency. It suggests silent hypoxia. Your oxygen levels are dropping, but your body isn't gasping for air yet. Your heart is struggling to push the red, oxygenated blood to the extremities. We often see this in the early stages of heart failure or COPD. The fingers are the last to get fed. If they are turning blue, the starvation has begun. Reason number 1, the capillary refill time, the CRT test, and finally, the number 1 test. This is the exact maneuver used by EMTs, nurses, and trauma surgeons worldwide to instantly assess the power of your heart. It is called the capillary refill test, CRT. You are going to do this on yourself right now. Step 1, hold your hand up at heart level. Do not let it hang down, as gravity affects the result. Step 2, take the thumb of your other hand and press down hard on the fingernail of your middle finger. Step 3, press until the nail turns completely white. You are physically pushing the blood out of the capillaries. Step 4, release the pressure and count immediately. 1 Mississippi, 2 Mississippi. The verdict: in a healthy heart with strong arteries, the pink color should return in less than 2 seconds. It should be an instant flush of blood. If it takes 3 seconds, 4 seconds, or longer for the pink color to return, you have prolonged capillary refill. What does this mean? It means your peripheral perfusion is poor. Your heart is not generating enough pressure to blast the blood back into those empty vessels quickly. It can be a sign of dehydration, shock, or widespread arteriosclerosis, hardening of the arteries. A study in the American Journal of Emergency Medicine verified that a prolonged CRT is a robust predictor of adverse cardiovascular outcomes. It basically says your plumbing is clogged or your pump is weak. If you fail this test, if your nail stays white for 4 or 5 seconds, do not panic, but do not ignore it. It is time to check your blood pressure and schedule a checkup. The solution: the red elixir. So, if your nails are telling you that your circulation is sluggish, what can you do today to open those vessels up? We recommend boosting your nitric oxide levels. Nitric oxide is a gas your body produces that tells your arteries to relax and widen. Vasodilation. The best natural source? Beetroot. Drinking 1 small glass of beetroot juice or adding beet powder to your morning water can increase nitric oxide levels significantly. This widens the highways of your blood, allowing the heart to pump with less effort and flushing oxygen all the way to your fingertips. Your body is constantly talking to you. The ridges, the moons, the color, the refill speed. These are messages from your heart. If you learned something new about your own hands today, please hit the like button. It helps us get this life-saving information to others. And don't forget to subscribe. In our next video, we will be discussing why your knees click when you stand up and how to grease the joint. Listen to your heart. It's the only one you have.